Hi, I'm Jude from Keep Our NHS Public North East, and I want to talk to you today about one aspect of privatisation of the NHS. It used to be simple in the old days. The health budget went to the NHS and the NHS treated the patients. But it became a lot more complicated in 2012 when the Health and Social Care Act was passed, and that required that health services be put up to tender so that private companies could bid for them, provided the service was over that amount of money. So why does it matter if private companies can put a tender in? Well, it means that the NHS has to pay somebody to write a bid for a contract, and then those bids are looked at by the clinical commissioning group, that is the NHS bid and all the other private companies. It might be that they decide to give the bid to a private clinic, and the first thing that will happen is that that private clinic will stick a big NHS logo on it so that you don't realise it's a private clinic. The shareholders of that private clinic will want some return for their money, so they'll want some of the profits. So the budget that we have, let's say it's for physiotherapy, because physiotherapy is almost 100% privatised already. So some of that budget has to go towards the tendering process, and some of that goes towards the shareholders. So this is our budget for patient care. However, we've still got this many patients. So how do you make up the shortfall? Well, what they might do is pay the physiotherapists less money, or they might pay them the same rate but not employ as many of them, in which case the patients aren't going to get as much time with their physio. Or you could just make it easy and just say, well, what we'll do is we'll just give these patients NHS treatment, and these ones, well, they can go private if they like, or they could just go onto a waiting list. And that might explain why even before COVID-19 we had 4.6 million patients on NHS waiting lists. So instead of coming up with all these different things about cutting salaries for physiotherapists, why don't we just not have this commissioning process? Nationally, it's estimated that the commissioning process costs anywhere between 4 and 15 billion pounds a year. If we got rid of that, we would have some more money in the budget. And if we got rid of paying shareholders just for having money, we could get the budget back, and that would take us back to treating our patients. So if you would rather that money was spent on patient care than administration, you might be interested in signing this petition, because what we need to do is get rid of this Health and Social Care Act. And this petition here is not our petition, but it is about getting rid of the Health and Social Care Act and renationalising the NHS, getting back to how the NHS used to be, and incidentally bringing back cleaning services back into the NHS. If you want to read more about privatisation or health campaigns in general, that's our local website, that's the national KONP website, and have a look at health campaigns together, because there are lots of campaigns out there. Thank you for listening.